Hello, dental hygiene students. Today we are going to be reviewing Chapter 14, Family Violence. Now, before we get right into this chapter, I wanted to discuss a few things. So, this chapter is a great chapter to review, especially right after reviewing EOIO, because you are going to be doing intraoral exams and extraoral exams on every patient every time. You need to be aware of signs and symptoms related to family violence, as well as sexual abuse. You are a mandatory reporter here in the state of Virginia, and you need to know what your role is as a healthcare professional when you come across a case. I also would like to make sure that you know the resources that are available to you for you to be able to provide to your patients. Unfortunately, if you want to learn more about the reporting laws, you're going to actually have to look those up yourself. They're not very specific in this book. Some information is very useful. I want you to take away what you are going to visually encounter as a clinician, but also what you do and how you go about helping this person in a situation. This chapter, you're going to be able to describe the general extraoral and intraoral signs of child abuse and neglect. You're going to be able to describe the general physical and extraoral and intraoral signs of elder abuse and neglect. And we're going to discuss the signs and attitudes of the abused in an intimate partner abuse and violence situation. We're going to discuss the role of you as a dental hygienist in reporting suspected maltreatment of children, elders, and intimate partners. We're going to discuss Munchausen syndrome by proxy and describe indicators associated with the syndrome. You're going to describe the general and behavioral indicators of human trafficking victims. So, interpersonal violence refers to family and community violence. The dental team needs to be able to know what their role is, and they have to be able to advocate for those experiencing family violence by identifying and reported suspected cases. Categories of family violence include domestic violence, intimate partner violence, and elder abuse and neglect. The ones at most risk are children, the elderly, people with disabilities, indigenous people, and LGBTQ+ individuals and women. Types of family violence includes physical abuse, emotional and psychological abuse and neglect, neglect and abandonment, financial exploitation, stalking, sexual abuse and violence, and medical and dental neglect. Your major types of family maltreatment include physical neglect, which includes neglect of dental and deprivation. Physical violence is non-accidental injury. Sexual violence is a non-consensual or exploitive sexual contact, and emotional abuse is mental anguish, despair, that's caused by ridicule, threats, intimidation, humiliation. It's used to control and isolate an individual. According to the World Health Organization, child maltreatment involves physical, sexual, and psychological emotional violence and neglect of infants, children, and adolescents by parents, caregivers, and other authority figures, most often in the home, but also in settings such as schools and orphanages. In the United States, sex trafficking was added to the definition of child abuse and neglect. Children who experience prenatal exposure to substance abuse by the mother are also considered to be victims of abuse. Child abuse is words or actions that cause harm, potential harm, or threat to harm a child, and may include physical, emotional, or sexual abuse. The definition of child neglect is failure to provide for a child's basic physical, emotional, educational, and medical dental needs. Other aspects of neglect include inadequate supervision and exposure to violent environments. Dental neglect is the willful failure of a parent or guardian to seek and follow through with treatment necessary to ensure a level of oral health essential for adequate function and freedom from pain and infection. Risk factors for abuse and neglect are multifactorial. They include individual, relational, community, and societal factors. Individual risk factors include being a girl, being younger than 4, having special needs. Relational factors, caregivers who are young, mental health issues such as depression, those who experience maltreatment as a child, and parents or caregivers who experience family violence. Community and social factors include unstable or lack of adequate housing, high amounts of unemployment, social, economic, and health education policies, and increased stress and community isolation. Consequences of child abuse. Several thousands of children die each year as a result of physical damage. Cranial, facial, head and neck injuries occur. And abuse needs to be considered in the differential diagnosis of any injury that involves a child. A major consequence of child abuse and neglect is death. Indicators of abuse or neglect include poor personal hygiene, clothing that is not appropriate for the weather. Behavior features include aggressive, destructive, or antisocial behavior. Social behavior, the child may act withdrawn or fearful in the presence of the caregiver. Emotional well-being, the child may have lower self-esteem. Cognitive features, neglected children exhibit lower IQ. However, neglected children exhibit well-developed problem-solving skills. Extraoral wounds and signs of trauma. Well, common abusive injuries inflicted on children include fractures and indicators of abusive injury. So that includes unexplained fractures, multiple fractures, skin injuries, lip bruises, head injuries include bald spots, conditions that can mimic abuse. It appears as a bruise, but it could be accidental injury, or it could be an idiopathic thrombocytopenia purpura. An appearance of burns can be an accidental burn. Skin lesions could actually be a birthmark. So it's always really important to ask questions. Inflicted abuse or injuries, you can see on these pictures. They're going to include the back, the arms, the legs, the face, the shoulder. On letter C, it's common sites of accidental injuries. They look pretty similar, right? They look pretty similar. Except this one's on the face. And this one's more on the head or the forehead. Alright, let's discuss the intraoral signs of abuse and neglect, because this is really what I want you guys to focus on. So, many injuries of the mouth can also be caused by accidental means. Maybe they fell, But intraoral findings that suggest abuse include lacerations of the tongue or the buccal mucosa, lingual and labial frontal tears, discolored teeth due to pulpal necrosis, burns or lacerations to the gingiva or the tongue, teeth that are fractured, displaced, or non-vital, and radiographic images of fractures in different degrees of healing. Then you have your signs of sexual abuse. That's going to include bruises or petechiae on the hard or soft palate, or a sexually transmitted disease that has visible signs in the oral cavity. Okay, parental attitude. Dental neglect is a failure of the caregiver who is responsible for the child. So dental prevention neglect is failure to prevent oral disease. Dental treatment neglect is failure to complete treatment of dental caries or pain. But risk factors for dental neglect by parental attitude are going to include low socioeconomic status, maternal dental anxiety, religious or cultural beliefs, or low health literacy of patients. Patients might assume because it's a baby tooth, we don't need to do that. The tooth is going to fall out, so sometimes we just need to educate them. Common characteristics of parents or caregivers. They seem disinterested when you're discussing any of the dental care that the child might need. They might miss the appointments, and they might lack interest in the conversation. Frozen syndrome by proxy, for those of you that remember Eminem's song, he talked about this. But it's a type of abuse where a parent or caregiver fabricates or induces a disease in the child. It's difficult to diagnose. Patient presents with a dramatic medical or dental history. Disease does not follow normal history or clinical presentation. And the perpetrator wants to progress to more invasive diagnostic procedures for the child. It's usually initiated by the mother of the child in 90% of the cases. And by definition, the perpetrator wants to become a sick person by way of the child to gain attention and sympathy from healthcare professionals. Perpetrators may have a history of child maltreatment, and half of the caregivers are in health-related professions. They're presented most often in young children up to age 2 and seldom older than 6. The child may participate in the deception as they grow older, but most often it's children up to 2 years of age and no older than 6. So we're going to talk about human trafficking. So there's just some general considerations that I want you to keep in mind here. So if you look up Polaris Project, you'll be able to see a map. And on that map, it tells you state by state in the United States kind of where human trafficking is going on. And in our area, it's very high. It's very high around DC, Northern Virginia, that area. So it's good for us to just be informed, right? Again, know our role when it comes to this subject matter. So human trafficking is a modern day form of slavery, and it's a global public health issue. There's many ways that children and vulnerable adults can be exploited, but generally it consists of sex trafficking, labor trafficking, and the majority of those that are trafficked for sex and labor are female, and about half of them are younger than 18. Risk factors are going to include a history of abuse or neglect, lack of a support system, substance abuse, maybe they're homeless, or maybe they have untreated mental health issues. Undocumented migrant workers are also at risk for human trafficking. Indicators of a patient involved in human trafficking. Well, 87.8% of individuals who are victims or survivors have seen a healthcare professional or healthcare provider. So they are coming in to seek treatment. The National Human Trafficking and Resource Center hotline is available to help healthcare providers and can guide them in assessment and referral. So the training resource for reporting information is on page 233 in your book. It's www.traffickingresourcecenter.org. The site provides a way to enter your city, state, and zip code and able to find social and legal services for the victim or their survivor. Okay. But indications or indicators may include the patient being escorted by another person who seems like they're in control, and usually it's the other person who speaks on behalf of the patient. There's unusual behavior such as being submissive. They may have tattoos or other forms of branding, and they may show signs of malnutrition. Now we're going to move on to elder abuse and neglect. So, general considerations. Globally, 1 in 6 in the community setting reports abuse and neglect. Victims of elder abuse are more likely to die prematurely and have greater risk of morbidity and hospital admission. Risk factors include being female, cognitive impairment, functional impairment, depression, social isolation, and living alone. Types of elder abuse and neglect. You have physical, psychological, financial, and sexual. Signs of elder abuse and neglect are going to include physical signs like bruises, marks, broken glasses. Signs of emotional psychological abuse include unresponsive and extremely withdrawn, unusual repetitive behaviors like rocking, depression or anxiety. Signs of financial exploitation include changes in access to bank accounts and wills. And signs of neglect and abandonment include unsafe living conditions and malnutrition. Oral-facial signs of abuse and neglect are going to include oral facial injuries. Over half of those who have experienced elder abuse are going to have extraoral injuries that might include lip trauma, bruising of the facial tissues, eye injuries, fractured mandible, or injury to the zygoma, particularly on the left side. Intraoral injuries include avulsed teeth, lesions or sores in the mouth from ill-fitting dentures, fractured dentures. You can see this picture here. The patient has bruises, but he has bruises that are at different stages of healing. Prevalence of intimate partner violence includes physical violence, psychological aggression, sexual violence, and stalking. Globally, 30% of women who had ever had a partner reported intimate partner violence. In the United States, 1 in 14 women and 1 in 27 men reported lifetime intimate partner violence. Indigenous women had the highest prevalence with 47.5%. Globally, intimate partner homicide of women is 38%. Black and Indigenous or American Indian or Alaska Native women have the highest rate of homicide in connection with partner violence. So they're going to have many of the same injuries listed for children. They're going to have injuries to the back, neck, chest, head injuries, abdominal injuries. During COVID, the incidence and severity increased, and healthcare providers have to be vigilant to identify these injuries and get the individual help. So that's our role. And that's what I want you guys to take out of all of it, right? It's what kind of signs do we see, what kind of injuries in the oral cavity will I possibly see that's related to this, and what do I do about it? So let's talk about reporting. So dental professionals are ethically and legally mandated to report child and elder abuse and neglect. So if it's a child or an elder, you are ethically and legally mandated to report. No ands, ifs, or buts. Okay? Studies suggest both dentists and hygienists feel inadequately prepared to screen for and report abuse. Therefore, training is critical. There are a lot of great CEs out there that talk about abuse and neglect and signs and symptoms and kind of what to do about it. There's great trainings out there, so I would highly recommend you look into that. PANDA is a great resource. It's Prevent Abuse and Neglect Through Dental Awareness. Project Radar is a provider-focused initiative in healthcare settings to promote assessment and prevention of intimate partner violence. And let's talk about the reporting laws of reporting abuse and neglect. So recognizing signs of suspected abuse and reporting protocol with health and safety of all individuals. So it's important for you to be observant and knowledgeable about the signs and symptoms of child abuse and neglect and know how to respond. Each state has laws, and it's going to be up to you to look into those laws. However, if it's a child or an elder, you are mandated to report. Okay? It's imperative to research the laws of your state and have them available to reference in your office. The practice needs to have a written protocol for documentation and reporting of abuse and neglect. You're going to have certain information with you when you're reporting. So here's some resources and hotlines that you can call in the United States and in Canada, depending on what the situation is. So for child abuse, you have the National Hotline. Domestic violence, you have this hotline. Human trafficking, elder abuse and neglect. Okay, just be prepared because there is some information that they're going to need from you. So they're going to need the child's name and age, the nature of the child's condition, the date, the time, the extent of the abuse and neglect, the perpetrator's information, including their name, their address, and the relationship to the patient. They're going to want your name, and they're going to need information for reporting. So in some states, the reporter's identity is confidential, but I'm not so sure here, so just be aware that you may have to give them your name. Forensic dentistry. So it's an aspect of the dental science that relates and applies dental facts to legal problems. It encompasses dental identification, malpractice litigation, legislation, peer review, and dental licensure. So it is a specialty, and it's not within the scope of the practice of any dentist or auxiliary without proper advanced training. There was recently a story in the RDH. So there was a recent article that came out where a dental hygienist talked about how she is doing forensic dentistry, and it's something that hygienists can do because we are trained to do everything that they do. So if you're interested in looking into possibly getting into forensic dentistry, the information is out there. So use of forensics in abuse cases. Sometimes they can use DNA from saliva and the tooth impression or pattern if there's a bite mark. We want to make sure that we are properly documenting everything. Okay? We want to provide the authorities with accurate information to support the investigation and to protect the abused patient from harmful circumstances or even death. The second person needs to be present. So somebody needs to be present to witness the examination and the interview. You want to document the date, the time, the place of the examination. You want to obtain a thorough history of the injury from both the caregiver and the patient, and record questions and answers to the exact words of the abused patient. You want to carefully record all observations, document all lesions, pay close attention to ecchymosis of varying colors and bilateral injuries. So ecchymosis is the bruising. Okay, you want to use diagrams to show the location, the size, and the description of what it is that you're seeing as far as the injury. Photographs and radiographs are great, so if you can try to get some photos, make sure you do so. Use the words suspected abuse if the patient denies abuse. And you can see on page 237, there is a documentation sample, and you can read that on your own time. Factors to teach the patient, where help can be obtained, The tendency of maltreatment usually increases with severity and frequency over time. Abuse can escalate and become life-threatening, and it is a choice and is used to gain power and control over another person. So again, when it comes to this chapter, I just want you guys to be aware of your role, know what those dental injuries, where they're located, what they might look like, who to call if you are ever in that situation. And that's it for chapter 14, you guys. I hope you have a wonderful day.